Hi, I'm Steve Robbins, and I'm here today with Jonathan Bush, co-founder and CEO of Athena Health, and now of Zeus. What's the full name? Zeus Healthcare?
Zus Health.
Zeus Health. I noticed a parallelism there. Welcome, Jonathan.
Thanks. Yeah, Athena who's your daddy.com was too much typing for the URL, so we went with
So
Zeus.
you got it. Um, Jonathan, you're one of my oldest friends. Uh, young at heart, but oldest in terms of we've known each other for quite a long time. And we met at Harvard Business School. I had been involved in the curriculum redesign, and we were unrolling the new curriculum for the first time. And there was a class called Business History. Actually, I don't know if it was business history. That was how we internally referred to it. I believe it was several forms of capitalism. And after one of the classes, the other instructors came up to me and said, "There's this young man who we're worried about. We want you to go out and make sure he's okay." And I said, "Who is that?" And they said, "Well," and they pointed out the window, and we could see this brown haired, blondish brown haired man striding across the field. And they said he got so excited and was so passionate about this class that we are afraid he might have an aneurysm or something. Could you just go make sure that he makes it back safely to his dorm? And that was how we met.
I loved those classes. I thought that foundations curriculum was just fantastic. And excuse me, and in an era where we really are dramatically declining in our ability to debate, the idea of sort of forcing people through a common toolkit just is, I feel the lack of it more than ever.
Yeah, it's in terms of being able to debate. Um, one of the things always struck me. Right, I come down on the Democrat side of the line, and you uh, are you come from a political family that is from the Republican side of the line, and yet we've
Yeah.
always been able to talk about things. And I think we've always been able to, to actually have productive discussions as opposed to the sort of knockdown, drag out stuff that seems to be what passes for discourse these days. And one of the things that has always struck me is coming from the background that you do, a coming from a family in which intervening on the world stage is just it's kind of something that multiple members of your family have done. How have you thought about your role in what you want to achieve with your life and where you want to take that passion that at the time was really kind of unformed? What difference do you want to make in the world? Start with an easy, trivial question here.
Well, my number one difference would be to have my kids come back home and see me, and so far that's working. It gets touch and go from time to time when I get tough about the recycling. But I think you sort of work your way out. And since I was very lucky to have a private education all paid for and a little bit of a nest egg to start a business with, and I've been able to sort of go out more rungs. And so I am interested in the doing some sort of internal plumbing work on the credibility of the American dream, and on then once it's as credible as we can make it, advocating for the idea of building things and making them available to others as a way of promotion, as opposed to tearing others down, which seems fundamentally zero sum games are a lot less fun.
Yeah.
So,
Well, or even
and
negative sum.
at every level. It's relevant in business. It's relevant in healthcare. It's relevant in business. It's relevant in the United States right now. I mean, this clubbing up with us and them groups seems to be missing just a huge point. So I'm interested in taking that on. And the only thing I really know is healthcare, maybe a little bit about people. So trying to do it through the things I know.
Now, how did you get into healthcare? I mean, the story of Athena Health
Well,
is actually kind of, I mean, I don't know how you first got into it, but I certainly know that you pivoted at one point. And so where it started and where it has grown and Zeus isn't a really linear path. And I'd love to
right.
hear you recap that. And
Well, I wanted to be. I think we all try to find a patch of soil that's rich and not crowded. So for me, as like you said, as a sort of Bush family member, politics is pretty crowded, and so is banking and sort of investment type businesses. Also, didn't feel like I was making the world safe for high net worth individuals and their families. Didn't quite move me much. So I found healthcare to be an area where you could really the product could be almost romantically useful, excitingly useful. You save someone's life or dramatically extend it. That was exciting, and it was pretty messed up. So there just was a lot of opportunity. It seemed from a distance to make it better. So originally I thought maybe I'll be a doctor. Then I learned about a couple of details like organic chemistry and decided that maybe I didn't have the chops. I also realized that once you become a doctor and you get your specialty, there's a lot of repetition in your life. You're not the arc of the story does not move as fast as the arc of a human experience. So end up a lot of doctors I know and love find themselves a little bit on autopilot later in their career. And I didn't want that. And I didn't think I'd be good at teaching or writing books or things like that. I did end up writing one book, but so I tried to find a way of getting into the management side of healthcare, which I discovered through an experience driving an ambulance in New Orleans, where the management side really could have used a lot of help, and where a lot of lives would be saved by changes there.
Now, Athena started not as a back end, not as an administrative company. It started as a series of practices.
That's right.
How did you come up with the idea for that, and what caused you to change?
My wife at the time, we got divorced later, sadly, but my wife Sarah was similarly like, what am we going to do? What am I going to do with my career? And I was working at a management consulting firm on the theory that I'd see a lot of companies and find something that interested me. She decided to try nursing school, and we decided that maybe together we could start kind of a lifestyle business where she would become a certified nurse midwife and I would be the practice manager of her, of her little practice. And Athena Women's Health kind of came out of that original inkling. And then as she got pregnant and got closer to how much blood she would have to see, she sort of backed away from wanting to do the clinical side of midwifery. And as I got closer to it, I saw it less as a beautiful family store that we'd run together and more as a national movement. I got more and more excited by the possibility of changing the way, this idea that you could be pregnant and not sick was profound and yet not obeyed in the delivery of care in the US or in the paying for it, which was absurdly expensive given what you got. So I got more and more grandiose and she got more and more oriented to kids. And, Athena then sort of became this concept of a birth center chain until we ran the first link of the chain into the ground. And then, as you said, we found the things that were working and that people wanted and ended up doing more and more of those. And they were humbler, more narrow tasks.
Got it. And so just for people who don't know, what did Athena Health morph into? Do you still have any? I'm assuming that the practices went away completely.
They went away completely. That was a condition for our first VC round to sell them off. And so it started as billing, finding the eligibility of the patient and what their copay would be and make sure you collected it. And sort of a McDonald's cash register for women's health and then eventually every specialty's front desk. And then we added other activities behind the cash register, the clinical workflow, documentation, patient communications, even hospital clinical documentation and billing eventually. By the time I got fired, we were just did that.
Got it. Wait, so
and start very narrow.
You basically, yeah. So it sounds like you basically ran a significant part of the back end of doctor and hospital offices. ultimately that
Yeah,
was where things moved up.
we were definitely the back room for the American doctor's office. That was our mantra.
Got it. And now
Let
Zeus.
doctors be doctors. That's what we said.
Sorry, say again.
Let doctors be doctors.
That's one of the interesting movements, I think, of the 21st century that I think is actually quite counterproductive, is the degree to which we have tools now that allow everyone to be able to do things like handle their own email and their own incoming communication, or do their own travel booking. And on one hand, this is touted as a good thing, and I mean, it sort of is. But on the other hand, it's actually shifted an awful lot of busy work and make work back on to everyone. So instead of just concentrating on the things that we each do best, unless we're lucky enough to have an organization around us, and I'm speaking as someone who currently is self-employed, um, it's kind of amazing that that all of this advanced technology in many cases has in fact made it so doctors can't be doctors unless a thing comes along and can help them step back and once again regain the part of the business that they own.
Right. There was a wonderful movie, a horrible, wonderful, beautifully made, horrible movie called Brazil, which had this alternate future sort of concept where, instead of computers, there were mechanical manacles attached to the fingers of secretaries so that they could type exceedingly fast the same bureaucratic, carbons that they had been typing in the 70s. And in a way, I think there's a fair amount of that mechanical turking going on in medicine, just as you described. And obviously a lot of what's going on right now in medicine, and what Zeus is very excited about is trying to eliminate a lot of the repetition, whether you type it or I type it. If it's repeated, how about nobody types it? How about we just find it where it was? And then having technology do the obvious steps so that a human doesn't have to, even with all the coolest labor-saving gadgets, humans like to have original thoughts. They don't like to be automatons. And particularly doctors who, done a lot of work accumulating a library of insight. And I think that's kind of what's happening now in medicine is, we've sort of made everybody type everything, almost like Brazil. And now we're finding ways of slicing that off, pieces of that off, and having the machine do it, or having a lower level skilled person do it. And it ends up being done better, and outcomes are better, and client engagement is better. So I'm hoping there's going to be a lot
What
more
electronic?
your
So
own ticket.
how is this? How is what Zeus is doing different from electronic medical records? Because I know I heard a lot about those about 10 years ago, and then last time I went to my doctor, they had me fill out 5 pages of hard copies. So I was kind of like, okay, I'm not sure where the electronic stuff comes in.
So that they
This was
can feed
literally
it
this
to
was
the
2 weeks ago.
electronic medical record.
Yeah.
Yes, exactly. You're living exactly what we're focused on. Yeah, there was a big push, federally funded push, to get everybody onto whatever the government called an electronic medical record, which was kind of a slice of a 3 or 4 layer cake, one bite, not the cake, not a whole disc, but one slice. So it would be at the front end, at the top of the cake, there'd be the workflow, the sort of clicky click, drop down blank fields for providers to capture whatever they saw about you. And then the next layer of cake was some compute necessary to turn whatever they're capturing into claims or other data summarizations, mostly related to getting claims paid. And then there was a database that stored at the bottom of the cake whatever you typed. Obviously, whatever you typed was not everything there is to know about a patient, hence your 5-page questionnaire, even though everybody's on an electronic medical record. So good news is they sort of got the paper out and they got the data in, but they got it in for everybody having these isolated little cake wedges of patients. What probably should happen is that layer of workflow should be much more customizable, not the same workflow whether you're an otolaryngologist or a primary care doctor or a therapist, but much more targeted ones. The compute should be across many more things than just getting a claim paid. And the storage layer, that bottom layer of cake, should be actually the whole picture of a patient. And every time that patient goes to a new place, they shouldn't have to create a whole new 3-layer wedge. They should be able to say, hey, go see my cake, as we do now with LinkedIn without even thinking about it. So Zeus is really focused on building a comprehensive bottom layer of cake, a comprehensive view. We call it the ZAC, the Zeus aggregated profile of every patient who wants to be aggregated. And then standing up lots and lots and lots of different compute options for quality measurements and consumer engagement. And then finally, offering workflows, that top layer of cake, but really letting most people build their own, either with low-code software products or with their own, in-house engineers, or by buying software products that have agreed to sort of tag into the Zeus data layer. So there's now a few electronic medical companies, record companies, that have said, hey, we're going to allow you to see the common Zeus record instead of invent your own fractile partial record on your patients. And that concept allows for an enormous removal of bloat that we all experience, which kills us, delays us, and mostly we recognize as causes us to fill out clipboards.
Right. Well, and then potentially, if you forget something, you go through the effort of filling out the clipboard, but B,
do you
now
really know
you're
exactly what dose of what drug and what its Latin name is? No, of course not. No one does. They do their best on the form, but that data should be accessible easily.
okay. So I'm actually real life example here. We're currently, for those people who are watching this in a replay, but currently we are at the beginning of a month of what some people fear may be a monkeypox epidemic. And I was told, oh, if you were vaccinated for smallpox, then it's possible you already have some immunity, and you may or may not need the monkeypox vaccine. So I went to my doctor and I said, have I been vaccinated for smallpox? And it turns out I only started using this doctor about 15 years ago, and I have no idea where my childhood vaccination records even would have been. So at this point, I have to simply assume that I wasn't. Is this the sort of thing that Zeus will fix? Because both my childhood doctor and my current doctor will have put things into my Zap. See, I'm already getting the terminology.
Yeah.
And then the other one would just immediately be able to see it. Is that what we're looking at?
Right. That's right. And you're describing a sort of a traditional primary care relationship, of which there are still many, but more and more people are sort of not subscribing to that, partly because of the lack of curated information, partly because it's just hard to access your doctor unless you're really well connected. It's 3 weeks to get an appointment, et cetera. So you've got more and more sort of always on digital first alternatives to traditional care, who are much more narrow in their focus and therefore much more in need of baseline data, of background data, in order to serve you well and not have you feel like you're talking to a dumb bot. So
Sure.
yes for primary care, but especially yes for digital first primary care, or online weight loss programs, and targeted alcohol abuse disorder programs, and narrowly focused diabetes management programs. All of these beautiful new sort of digital intensive or digital first solutions are in particular need of the rest of the picture, because they don't want to be a generic generalist. They want to be a superpowered, as they said at business school, a focus factory. So the need is there in traditional settings, and it's even more so in the newer care modalities that are so excited right now.
Now, there's a word that you have specifically not said here, and it is a word that brings up many other connotations, which is you have not said blockchain, for which I thank you.
AIML, blockchain, distributed ledger, yeah.
But what I'm curious about is when people talk about blockchain and blockchain's use for things like medical records, they're usually talking about two things. One is giving patients control over their data, and two is some amount of security and some amount of being able to decide who can and can't access that data and how. how are you thinking about those issues? Because obviously, if there's one database that has everything about me, that could be abused in certain ways by insurance companies who want to decide to find reasons to deny me claims, by employers to discriminate, et cetera, et cetera. So, how are you
Yeah,
solving that?
very interesting topic, because what's particularly interesting about it is that there's the Health Information Portability and Accountability Act, which governs privacy related to medicine shared in the course of care delivery, shared amongst providers and health plans, those that are sort of designated with a need to know. Um, if you have a need to know, um, the constraints on what you do with people's data are very, very weak. There are very few. So ironically, what we struggle with at Zeus is we don't we if we went to traditional providers and said, hey, we're going to further restrict what you can do with your data, uh, they'll be saying, well, thanks a lot, but no, I'm not going to use you. Uh, Whereas I think over time, consumers would like to say, hey, even if you're a covered entity under HIPAA, if you piss me off, I want to block you. I don't want to see you. So Zeus is building the ability for patients to block providers and others with a sort of a very granular, like your Plaid dashboard, which banks do we want to keep turned on kind of thing. But what we have to balance against it is the path by which the data was obtained. There's a new set of laws that are not yet in use really at all, called the Cures Act, which are consumer mediated. The consumer says, I want to share with Stever, I want to share with Fitbit, I want to share with, you can share with anything. It doesn't have to be a doctor. Under that act, the consumer can then unshare and can see who's accessing, et cetera. Under the old act that is used among providers, the consumer doesn't even get to know who's looking ever. As long as the provider, as long as the entity that's looking at them is somehow involved in their care, they're allowed to go ahead and do whatever they want. So it's an
Okay.
interesting dynamic.
And so Zeus is going to be it sounds like Zeus is going to be possibly a key component in implementing this Cures Act, because you're going to have the technology and you're building with that in mind. And I would assume that other people are not, or because I want to believe that you are at the absolute cutting edge of everything, because that's what I think of you
Well,
as.
we're building. I mean, at one level, it's a very cutting edge company. I mean, the technology is new and the documentation is new and good. At the other level, it's the oldest freaking PowerPoint slide in the history of healthcare. Hey, why aren't we using a common record? It is not a new idea, So we think we've got a business model that's new. Getting digital first players to be the creators of the first steel thread. The first, if Zuckerberg did hot or not at Harvard, and LinkedIn did, best employees of my best VC portfolios as their atomic networks, we think there's a similar play among these digital first healthcare providers that don't have designs on being a vertical monopoly for all health information. They really want to be a focused factory. And so we think there's a moment in time now where there are enough people who want this selfishly, whose business is made better by a common record, that will be able to get to a minimum viable product. And then it'll be hard to not look. Like, you're about to operate on someone, you don't want to check and see what drugs they're allergic to or what have you. So I think once the genie gets out of the bottle, it'll be a no-brainer. And I hope that these new digital first companies that have gotten so much venture capital in the last 4 years will get that cork off the genie's bottle.
Well, I'll tell you that, right. This is clearly one of those things where if you can succeed at being the one who ties everything together, I mean, well, it's a platform play, and we all know that platforms are like the best thing to be in a lot of ways. And it's also tricky to get to be the one who is the platform, but timing and vision and
energy and turn it into kinetic energy. Why you, white man? And so Zeus's job is to go and buy data that people don't have on their patients, to go and build out APIs that make viewing data more convenient, where you're not drowning in noise, to do enough things with tools and acquired data to make it worth getting on the platform in the first place, that you gain more than you theoretically.
Whoops. I don't know if you're hearing me. I just had my screen freeze up. Um, I'm going to proceed as if you can hear and respond, and we'll see if that's true. Um, um, so, one of the things I would like to bring this back to is bringing it back to you, Jonathan, as a person. Aha, I am hearing that I may be continuing, but Jonathan is frozen. Uh-oh. Okay, then I guess bringing it back to Jonathan as a person isn't going to work. Um, Rats, let's see. I guess we're going to have to wrap up. The question that I was going to ask was, I'm curious as to how all of this relates to Jonathan's uh, non-political ambitions at this point. But basically, he comes from a family that changes the world. You can agree with the way they change it or not, but they think on a very large scale. And I'm very interested in knowing how Zeus and how what he's doing is meaningful to him in the sense of creating that kind of world change. And that said, looks like he's dropped completely. So those of you who have been here, thank you for joining, and I hope that we have a chance to see Jonathan again at some point and finish out the conversation. So thank you very much, and stay tuned for our next live stream.
And we're clear.
I assume you were going to say, and we're off.